Welcome back to Knee Health Challenge. We're on week 3, day 22. Today is assessment day. We've done this many times over, so I'm going to kind of go through this a little more quickly. We'll have the video play in the background. So as you go through, watching how you maintain, if you notice some of your numbers start to decrease, some of that is due to soreness, some of that is damaging certain tissues so they can rebuild back up. So that's where nutrition, that's where sleep, and all that is very, very important. So as you can see from some of the videos, some of them maintained, some of them got better. You can pause and look over those if you'd like. Wanting to look at from week 1 or when we first did it all the way up until this last week. We're going to keep challenging ourselves as we go through. So keep on at it, keep doing your thing. All right, so I'll kind of fast forward here. So pretty good in terms of progression, especially left leg. I think as that ankle is healing up much, much better from the week 1. We're starting to get that range of motion when we first came in. Between internal, external rotation, all the numbers have progressed incredibly well. So keep going through that. In terms of finding time throughout your day, if it's easier for you to do in the morning, by all means in the morning. It's easier for you if you have kids, when the kids are asleep, do it before bed. That's fine. Ideally not right before bed. You probably want an hour or two, because as you increase the effort level, the cortisol will also increase with it, which that'll throw off your circadian cycle. It also, especially if you're not used to it, in terms of times of sleep, that can throw off a few things. So that is a little bit on week 3. Overall, good progressions for me, but I'm more concerned about you moving forward. So now we're going to get into what's called Nordic curls. Now with this is working different angles of the hamstrings, from the neutral position where the feet are even with the hips, even with the wall. And then we're also going to get into internal, external rotation as well. You can use a towel. You can use a foam block pad, roll up a comforter on laying on the ground, either or. If it's hard for you to progress from there, what I want you to do is just start off by trying the knee, like kneeling on your knees. Depending on past surgeries, if you're just a few weeks out from knee surgery, obviously we probably don't want you doing Nordic curls, not in this way. But if you're anything past a few weeks, even a couple months, you got to start by trying to put a little pressure on the knees. So just start off by kneeling. If that is easy for you, I want you to kneel, and then we're going to lean our body weight forward. Now you can also have your heels over, or excuse me, even feet underneath a couch. Ideally, if you have a bar at the gym, trying to have those heels connect underneath, that will help much, much better as well. So the purpose is to have your body weight go over your knees, so it forces the hamstring muscles to hold on tight in weight of your body weight, or in lieu of your body weight. You can have your feet or knees come inwards and feet outwards, or you can have your feet inwards and knees out. We're going to try both ways, all of which affect different muscles around the hamstrings, adductors, abductors, pretty much the muscles on the back side of your upper legs. So as we're going through this, if your feet are outward, it's putting more pressure outwards. If your feet come in, it's putting more pressure on the inside. Simple enough. So for me, I chose to start at a clock, and I wanted to go till failure for me in each position. So for each one, I kind of already calculated these numbers out already. So once you gave out for me and you're going to start shaking, that's okay. Go through it. If you start feeling any sharp pain or pain itself, back off completely. So for the first one, 17 seconds, awesome. Now the knees are going to come inwards and feet are going to come out. I'm going to put more pressure on the inside back leg muscles, adductors, semimembranosus, tendinosus. And that last one was 12 seconds. And then with the knees out, feet in, that was 13 seconds. And again, that's working a lot of the muscles on the outside of the legs too. So I want you to do each position until failure. that is the goal for today. Also assessing what we have got going on in terms of week to week progression. So keep on with it. We're almost there. We can see that light at the end of the tunnel. Keep doing your thing. We'll see you guys on the next one. Woo!